is Sharon Karlsberg. I'm a principal and co-leader of our oncology dedicated practice at ZS Associates. I'm here today with Dr. Michael Bishop, Director of the Cellular Therapy and Stem Cell Transplant Program at the University of Chicago. Dr. Bishop, thanks for joining me today.
Oh, thank you.
How long did it take to get the center ready to be able to accept and act quickly on these
So
patients?
we started thinking about this 3 years ago. So when we were doing the clinical trials and we were seeing the very encouraging clinical results, we go, inevitably, this is going to be commercialized. And actually, we started an entire 12-month planning process where we broke down every single component to the point where you take a telephone call to the point where you return the patient back to the clinic. And we did a systems analysis on this. And that was our mindset. And then we said, what will we need? Well, how are we going to be able to get that patient, like I said, into my clinic the next day? How will I be able to set up the apheresis? How will the institution, where will we put the patients? How will we be able to take care of them in the clinic? And we developed over 60 standard operating procedure documents, how to take, can we have these? And it's a little proprietary. You go, yeah, we do all the work, but on the other hand, we want to help other centers do that. How did you deal with it from insurance perspective? How do you do in terms of your management? What do you do with these procedures? Because it really is highly integrated. That's really the market difference between doing a stem cell transplant is the integration with other services.
What are the other changes that are needed in the environment to make these therapies more accessible, whether it's reimbursement or education?
Reimbursement. So I can take another example of this. So one of the other things are, do you need to send the product away 2,000 miles to a facility? Mm-hmm. Could you actually have in your own institution? So there's actually devices being developed so that you could actually produce the CAR T cells within your own institution in a closed system. And so what you would do is have companies actually sell you the box or actually the vial with the virus.
Oh.
And you have this device and it's to a certain standard. You collect the lymphocytes just like you would have otherwise, but now you take them directly to your cell therapy laboratory, a device about the size of a 4x4 table, completely enclosed, FDA approved. You put the cells in, under very strict criteria, you introduce the virus. 7 days later, there's your CAR T cell product ready to go, not having to ship that cuts down the cost.
Well, Dr. Bishop, thank you for your commentary. As you can see, there are so many changes happening in the field of cell and gene therapy. Today, Dr. Bishop's illuminated many of the exciting advances happening for patients with DLBCL, multiple myeloma, and we certainly hope the future holds hope for more patients, more personalized medicine, moving into the solid tumors and far beyond. Thanks for joining us.
Thank you,
Dr. Bishop.
Appreciate it.